Hello, and welcome to an informal session regarding one of the best investments that you have made in your life. This orientation will educate you on what exactly functional medicine is, the difference between functional medicine and conventional medicine, as well as the principles of functional medicine. We will explain why you should choose the functional medicine route and how it will help you to live a life of longevity with overall optimal health, meaning that the focus is not just on the body, but also the mind and spirit. We will go over a list of all the education courses that you are required to complete as part of your program. During this presentation, you will hear about all of the amazing optimal wellness classes that you will have access to that will help educate you on how to engage in a healthy lifestyle. Last but not least, you will learn a little bit of background information about our providers here at Carolina Healthspan Institute. We are very proud to say that we have some of the best trained and highly skilled providers around, and you will have the opportunity to work with them one-on-one to help optimize your health. We want you to be active, be assertive, and recognize your important role. Be a partner in your healthcare. My name is Precious Wallace, and I am your patient liaison. At an early age, I decided to obtain my degree as a registered medical assistant and pursue a career in the healthcare industry. I decided to go this route after having to take care of my mother at an early age who suffers from many health issues. I have over 10 years experience as a lead medical assistant in internal medicine, family medicine, and specialty clinics. I also have experience as a clinical specialist working in emergency medicine and urgent care. I later attended the University of Phoenix where I obtained a Bachelor of Science in Health Administration and Management. My passion is to help others by educating and being resourceful, being a partner in their health care. I am here to ensure that the coordination of your care runs smoothly and that the communication between your PCP, specialty, and our providers are efficient and effective. Whenever an appointment is needed in-house or a referral, I will be the one to schedule or facilitate these appointments. If you need any injections or blood draws, I will be doing that for you also. If you have any questions or concerns, you can always direct them to me and I will get an answer for you. I am also here to ensure that you are following through on your care plan that has been individualized to meet your personal health needs. We will be setting milestones together, so I may challenge you to go to your end goal. I may tell you what to eat, but I will not go grocery shopping for you. I may tell you to work out more often, but I will not be at the gym with you. This is going to be a process and it will take a little time. We have 6 months together and I know that you can do this. It takes 6 weeks to change or break a habit. I am here to ensure that you are following through so that we may see final results that we're seeking. This program is really about changing your mindset, which will be your next education class, changing how we think about food, exercise, and life in general. You cannot do the same things and expect to see change or results. This means that we will set realistic goals that are attainable. I am available in office via email or phone Monday through Thursday from 8:30 a.m. to 5:30 p.m. and Friday 8:30 a.m. to 2 p.m. I am available via cell phone Monday through Friday between the hours of 5:30 p.m. and 8:30 p.m. For example, you may have a question about a certain medication that you are taking, or you need to verify an appointment date and time. What is functional medicine? Functional medicine addresses the underlying cause of disease using a personalized, system-oriented approach. It addresses the whole person, not just an isolated set of symptoms. Functional medicine is a medical practice or treatment that focuses on optimal functioning of the body and its organs, usually involving systems of holistic or alternative medicine. We have practiced functional medicine for over 13 years, floundering around with different labels such as holistic care, preventative care, and etc., but the most approved is functional medicine because it identifies with core values. Carolina Healthspan practitioners spend time with their patients, listening to their histories and looking at the interactions among genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. Functional medicine incorporates the latest in genetic science, systems biology, and understanding how environmental and lifestyle factors influence the emergence and progression of disease. Functional medicine enables physicians and other health professionals to practice proactive, predictive, personalized medicine and empowers patients to take an active role in their own health. You don't have to have a disease to benefit from functional medicine. Principles of functional medicine. Our approach to functional medicine is guided by 6 principles: an understanding of the biochemical individuality of each human being based on the concepts of genetic and environmental uniqueness, awareness of the evidence that supports a patient-centered rather than a disease-centered approach to treatment, search for a dynamic balance among the internal and external body, mind, and spirit, interconnections of internal physiological factors, identification of health as a positive vitality, not merely the absence of disease, and emphasizing those factors that encourage the enhancement of a vigorous physiology, promotion of organ reserve as the means to enhance the health span, not just the lifespan of each patient. How is functional medicine different? The illustration of a tree is used to visually represent the core aspects of the functional medicine per diem and highlight the difference between conventional medical care and care at Carolina HealthSpan. In order to keep a tree healthy and allow it to flourish, you need to support the most basic and essential elements first: the foundation, the roots, and soil. At Carolina HealthSpan Institute, the same approach applies to patients. The most important factors, and the ones we examine first when gathering information about the patients, are the foundational lifestyle factors such as sleep, exercise, nutrition, stress levels, relationships, and genetics. These are the roots and soils, which are in turn influenced by specific predisposing factors, discrete events, and ongoing physiological processes, and may then result in fundamental imbalances at the trunk. These can eventually result in the signs and symptoms that are grouped into diagnosable constellation that we call disease, represented by the branches and leaves. Conventional medicine tends to look at the constellation of symptoms first, the branches and leaves, which usually results in a disease diagnosis. Often, this diagnosis is associated with a drug or drugs that can be prescribed to treat this constellation of symptoms, and that is the end of the story. This approach neglects the more fundamental aspects of health that reside in the roots and the trunk of the tree. It treats all patients that present with similar symptoms are same and completely neglects both the inherent differences among patients as well as the countless possible causes that a disease can have. Functional medicine versus conventional medicine. To begin, the focus of care is different. The goal of conventional medicine is for doctors to identify diseases by recognizing patterns of symptoms and to treat those symptoms by prescribing drug-based therapies that are similar for all patients with a given disease. The goal of Carolina HealthSpan Institute is to promote healthy and vitality in each patient. Practitioners examine each patient's lifestyle and unique biochemical factors to identify the underlying causes of their disease and find treatments that help return patients to optimal health. Conventional medicine separates doctors based on their specialties, for example, neurology, gynecology, endocrinology, effectively arranging medical care into separate silos. Functional medicine is holistic, and that one clinician looks at all aspects of the patient instead of saying, "Oh, that sounds like a hormone problem. That's not my specialty. You'll have to go elsewhere." Care and services rendered through Carolina HealthSpan is highly cost-effective for patients, and it focuses on prevention and health-promoting lifestyle changes and sustainable treatments that address the underlying cause of dysfunction, restoring patients to health. Conventional medical treatments are often expensive medications that must be taken indefinitely and do not address the underlying problem but merely suppress the symptoms and sometimes causes chronic diseases and other health issues due to the long-term use of medications. Why functional medicine? Our society is experiencing a sharp increase in the number of people who suffer from complex chronic diseases such as diabetes, heart disease, cancer, mental illness, and autoimmune disorders like rheumatoid arthritis. The system of medicine practiced by most physicians is oriented towards acute care, the diagnosis and treatment of trauma or illness that is of short duration and in need of urgent care, such as a heart attack or a broken leg. Physicians apply a specific prescribed treatment such as drugs or surgeries that aim to treat the immediate problem or symptom. Unfortunately, this does not help with complex chronic illnesses. Functional medicine is a different approach with methodology and tools that are specifically designed to prevent and treat chronic diseases. The scientific community has made incredible strides in helping practitioners understand how environmental and lifestyle influences moving continuously through an individual's genetic heritage, psychosocial experience, and personal beliefs can impair basic biological functions. Using this knowledge to find the sources of each patient's problem is powerful science. Medical science has recently provided strong evidence that the relationship between patient and clinician has a powerful effect on patient health outcomes. Here at Carolina Healthspan Institute, we focus on the therapeutic partnership because we understand that it's an important part of how patients heal. Making effective healthcare choices involves the clinician and patient in a relationship where information and belief, attention and insight, communication and trust all have value. Carolina Healthspan practitioners are taught how to craft a personalized, system-oriented therapeutic plan for each unique patient using evidence and insight, art, and science. Optimal wellness. You have made a great investment in your health, and we are proud to be a part of this experience. The Optimal Wellness Program offers group education where you are required to join in on an informal session at least once per week or every other week regarding important topics such as results in mindset, nutrition, brain health, sexual health, stress management, supplements, exercise, and last but not least, toxins. You will have access to our online Optimal Wellness Academy that is loaded with information. You will also have unlimited provider visits and phone calls along with your own patient liaison who will coordinate all of your care. Next, we will go over the provider's bio so that you can get a little bit of information about their background, specialties, and their walk in the healthcare spectrum. Each of our providers have a specialty in which we will go over so that you will have a better understanding of where they come from and the different experiences and opportunities they have each had. Since each provider has something different to add to helping you reach your healthcare goals, all of your appointments will be coordinated through a liaison to ensure that you receive the most out of your visits. Our providers work hard for that they believe in what they Our providers work hard for what they believe in, and that is why they really walk the walk and practice what they preach. Our providers are actually networking with some of the top providers and people in the country to bring you the best care possible. It's not like they're picking up a journal or reading it and then portraying information that we have read or learned. We have partnered with over 200 clinics around the country to advance healthcare to the next level. Our providers believe in advancing education versus continuing education. This is because continuing education is when you must take certain contact hours of instruction in a board-approved continuing education class or activity in order to fulfill requirements for your license. Advancing education is just what it says. You're advancing your education, except it's by choice. Our providers have chosen to advance their education in the leading edge of medicine and health to ensure that you have access to optimal health and health care. Dr. Ronald Brown, a graduate of Davidson College and the Medical University of South Carolina at Charleston, South Carolina. In 2004, Dr. Brown founded Carolina Healthspan Institute so that he and his team could focus on brain and body-based wellness issues for women and men while creating optimal health through functional, proactive, and preventative medicine. Dr. Russo is a board certified physician receiving her medical degree from the Medical College of Pennsylvania. Dr. Russo was handpicked and trained on bioidentical hormone replacement by Dr. Brown himself, the founder of Carolina Healthspan Institute and the author of The Youth Effect. Dr. Crowder is a magna cum laude graduate of Duke University and earned her medical degree at the University of Virginia. She has expertise in bioidentical hormones and women's health and optimization. Brittany received her bachelor's in health in science and cognitive and behavioral neuroscience from University of Mount Union, as well as her master's of art in clinical mental health counseling and addictions counseling from UNC Charlotte. She has expertise in neurofeedback, life coaching, and memory coaching. Hillary Shafto, after receiving her Bachelor of Science in Exercise Sports Science from Elon University, Hillary achieved her Master of Science for Clinical Rehabilitation and Mental Health Counseling at the University of North Carolina in Chapel Hill. She has expertise in neurofeedback, life coaching, addiction therapy, and nutrition. Margaret Conger, after receiving her Bachelor of Science in Mass Communication and Art Applications, Margaret joined Tahoe Forest Hospital where she was exposed to a wide range of healthcare, including holistic approaches. She has expertise in biofeedback, yoga therapy, mediation, and breathing techniques. Laura Solomon. Laura received her Bachelor of Science and Master of Science in Nursing from the University of North Carolina. She is a current member of the Institute for Functional Medicine and has completed several of the advanced practice modules. She has expertise in bioidentical hormones, functional medicine, adrenals, and timeline. Group education. Group members can learn from each other. It is advantageous to seek support from people in similar situations that can provide you support. Group education is a great way to give and receive motivation and support from fellow group members. There are 8 different education classes for you to attend or view online, in which we will go over each class and give you a little detail as to what you should expect to learn from a particular class. You can expect to learn a lot from each class and the different topics such as factors that prevent illness and promote or damage health. The goal of this education is not only to increase your health knowledge and to create positive attitudes towards your own well-being, but also to promote healthy behaviors. We encourage you to ask questions so that you can understand and comprehend and can have something to go back and look at for future references. You should each have a copy of the monthly class schedules, and we can take a look over them momentarily. If you happen to miss a class, you can reschedule for the same class at a later date and time. You will also be given a key takeaway sheet from each class and a list of action items to help you get towards your health and life goals. The first class is Results and Mindset, taught by Joe Warren, certified Tony Robbins results coach, owner of Transition Coaching. You'll learn different things in this class such as goal setting, action plans, and limiting beliefs. Nutrition will be taught by Kelly Gilbert, integrative health coach and owner of Modernly Healthy. In this class, you'll learn things such as setting yourself up for success and taking a virtual trip to the grocery store with an expert. Brain Health and Fitness. This class will be taught by Brittany Cirulo. You'll learn things in this class such as understanding how the brain works, how it should work for you and not against you. Also, a plan to keep your brain healthy, resilient, and efficient. Fitness. Fitness class will be taught by Hilary Shafto. You'll learn things such as the different types of exercise and their benefits, finding the right plan for you, and overcoming obstacles. Toxins. Toxins will be taught by Seth Conger. You'll learn things such as playing good defense and keeping your brain safe. Stress management will be taught by Margaret Conger, and you'll learn things such as different types of stress and the effects of stress on your body. Supplements will be taught by Dr. Russo. You'll learn different things such as why supplements, supplement recommendations, and different resources. Sexual health will be taught by Laura Solomon, and you'll learn things such as proper hormone balance, sex in your brain, and why you shouldn't be shy and you should speak with your provider. Optimal Wellness Academy. Optimal Wellness Academy are also educational videos regarding different topics such as goals, detoxing, food for health, inflammation, diabetes, and much more. These are educational videos that are here for you to utilize as a resource as well. I have signed each of you up to have access to our Optimal Wellness Academy online. So briefly, let me introduce you to Matt and Charlie, who you will become very familiar with from watching the videos. We have partnered with an amazing group of individuals who are excited as we are to help you obtain your goals. Some of the videos are general education on things such as gluten, disease process, why we do labs, and so forth. You will see Matt and Charlie in the videos, but they are also here to help you every step of this education curriculum, ensuring that you have the tools, strategies, knowledge, and mentality of where you want to go and what you like to accomplish. You're probably wondering why you don't see Dr. Brown and Seth in any of these videos. That's because they are currently taking acting classes, as we are actively filming education classes and uploading them for you to utilize as well. You will have unlimited provider visit calls and visits. As part of your Optimal Wellness program, you will have unlimited provider office visits and phone calls during your 6-month time frame. These visits will consist of the creation and modification of your care and treatment plan and milestone visits with a member of the care team. Your education is just as important as the provider visits, and you will be discussing the topics you have learned and how to best apply them during your provider visits. All of your visits should be scheduled with me or by me, so that all you have to do is sit back and focus on your care. You each have diagnostic and supplement banks. You have a significant diagnostic and supplement bank that has been preloaded with your money for any treatment or supplements that the provider feels is necessary. This ensures that our providers are not held back and can use different advanced treatment techniques to get you to your goal. Each time a service is rendered or supplements are suggested, it comes right out of your diagnostic and supplement bank. An example of these banks would be as follows, such as labs, advanced blood work like the Nutravel or Cyrex. The supplements would be your vitamins such as probiotics, Omega XL, grapeseed extract, and more. If the provider feels that a prescription that is not kept in-house needs to be called into the pharmacy for you, you will have to pay for the medication out of pocket. For example, DMSA, thyroid medication, and more. You can check with me at any point to find out the remaining balance in your bank. We would like to say thank you for choosing Carolina HealthSpan. Our focus is on educating individuals and providing them with the most effective and advanced tools, techniques, and procedures to meet their health goals and optimize their lives. We believe your quality of health from your brain to your gut is your most important asset, and our aim is to be your trusted partner in protecting this asset.